Our next speaker is Marina Genchev, MSW, I believe, from the University of Southern California. Marina is Senior Manager for the Adult Coordinated Entry System for the Los Angeles Homeless Services Authority, otherwise known as LAHSA. Thank you, Marina.
Thank you. Yes, I'm actually a Trojan twice over, so it's double damage, double duty here. And I am wearing cardinal and gold by accident tonight. Let's see. Where's the on button for this?
Actually, you can just
You can hear me all right? All right, we'll do just this one. So it's my pleasure to be here with you this evening to share a little bit about the state of homelessness in Los Angeles today, as well as what we are doing in response, primarily in the context of the coordinated entry system. So LAHSA is the Los Angeles Homeless Services Authority. We're a joint powers authority of the city and the county of Los Angeles. The story goes that the city and county had a little spat, and the baby was the Los Angeles Homeless Services Authority. We have taken on a new role in the last few years, which is being the lead for the coordinated entry system. But before I get into the work that we are doing, I'll share a little bit about the state of homelessness today. If you live anywhere in Los Angeles, you have noticed, I am sure, the visible increase in homelessness occurring in our city and in our county. The last homeless count estimated that about 53,000 persons were experiencing homelessness. These are numbers from 2017. If you participated perhaps in our homeless count in January, thank you. The 2018 numbers will be coming out probably in about May, so keep an eye out for those. Fingers crossed, we'll continue to see a decrease. For the last year, 2016 to 2017, we did see a slight decrease in both the city and the county. For the 4 years prior, though, those numbers did continue to increase. Despite that growth and surge in people experiencing homelessness, we are actually housing people at a faster rate than we ever have. In the last year, we housed over 16,000 persons experiencing homelessness, which is impressive work by all of the partners doing this work. In addition, youth housing placements, so youth is a cohort between the ages of 18 to 24, housing placements for that population spiked by 43%. We also, between point-in-time counts from 2016 to 2017, saw decreases in both veteran and chronic homelessness by 19% and 18% respectively. So that is great work that we are doing. However, people continue to fall into homelessness for the first time for primarily economic drivers such as loss of employment and other financial reasons. And as you saw the slide from the homeless count, a lot of this is very visual. It's very salient to us because people usually have a vehicle, or if they have a vehicle, it's the first place they go, and then to a tent and then to street. So right now it's very present based on kind of how homelessness continues to shift. So imagine the scope and scale of all of that spread over this geography. If you can't see quite closely enough, I'll share with you the slide on the left, or the visual on the left, is the city of Los Angeles. Within the city's geography, you've got St. Louis, Cleveland, Minneapolis, Milwaukee, San Francisco, Boston, Pittsburgh, and all of Manhattan would fit in the geography of just LA City. If you continue that comparison in LA County, and if you've ever driven from the top to the bottom, you know it's quite big. You've got Des Moines, Raleigh, Jackson, Carson, Little Rock. I mean, the list goes on. And so these 88 cities over the vast geography with a complex, the richness of our city and county also adds to the challenges when you consider that population in this geography. And so before we had a system, it's hard to imagine that there would not be a systematic response, but in actuality, there was not until only very recently. So what it felt like trying to navigate and access services from a client perspective or from the experience of somebody experiencing homelessness was you were either successful based on self-advocacy, other advocacy, or some luck. So by self-advocacy, we're talking about very able-minded, able-bodied people who are able to make phone calls, advocate, stand in lines at buildings opening up, fill out complicated housing authority applications, do that system navigation work for themselves. Or perhaps they got lucky and found a case manager who really empathized with their plight or was really good at their job, and perhaps they could be successful through that method, or perhaps they were just lucky. But the people that we were helping and the people that were getting the help weren't necessarily those most in need. If you think about geographically, regionally, where resources were, you think about the beaches, you think about Skid Row, you think about Hollywood, but what about Studio City? What about Diamond Bar? What about Bellflower? Like all of these smaller cities, if you were homeless in those cities, what then? So we didn't have a response for those people in a comprehensive way. As service providers as well, we were not coordinated. We were very siloed and competitive. this is my clients, these are my resources, these are my services, these are my outcomes, these are my numbers, not thinking about the collective good, not thinking about maximizing good and ensuring utilization of resources in a strategic manner, just kind of wild, wild west of homeless services. So, little surprise that we needed to coordinate, and what that coordination looks like is the coordinated entry system, which, I could give you a definition, but quite simply put, the coordinated entry system is Los Angeles's crisis response system for homelessness. It's the system that we didn't have before. And so, behind the front door of that system are essentially almost all of the resources that could respond or do respond to persons experiencing homelessness. And so LAHSA here today, we are a funder. Yes, of course, we administer city and county dollars as well as state and all federal dollars for this region. But it's not just our resources that are behind that front door of the system. There's also the resources from the departments of mental health, health services, substance abuse, children and family services, probation. The list goes on and on. The coordination goes on and on as we try and figure out how do we do this together in a more smart way. In addition, I'll mention HUD does require that we would have this system. So yes, we're checking a box, but I think hopefully I've shared with you a little bit of an explanation about why I think this is the smartest response. That being said, system building is some big work, it's a heavy lift. And so LAHSA came into ownership, if you will, of the systems for all these populations a few years ago. We didn't necessarily start the subsystems for each population. We kind of were bequeathed some of them. And so the effort now is to really shake out some of that nuance and know that the response for a family might be different than for a youth, might be different than for an individual adult who's chronically homeless. There might be nuances in how we approach the resources that are needed, but how we are easy to access, how we are engaging, how somebody can move through the system. Those things shouldn't be the hard part. The hard part should be survival. Accessing homeless services shouldn't be hard. In that's the goal. Sometimes we are successful. I don't think we're fully there yet as a system, but that is the intention, to create a system that is more effective, efficient, and fair for people experiencing homelessness. It's not, of course, just us as the funder and system lead who's doing this work. There are lead agencies in each of the regions in the county for each of the subpopulations who lead this work. And in addition, we've began to prop up a lot more what we are calling access points or access centers, because saying, hey, everybody in the South Bay, go to that single point, obviously is crushing for those single entities. It was a great idea to start with. It no longer works. And so we're in the process of propping a lot more points of access where we can say more readily, these are all the very many places that a person could go to get services. So what kind of services and what does that flow look like? The flow through the service path itself can vary, but I'll talk about what happens that's essentially the same, whether somebody comes in via outreach or via an access center, whether somebody accesses shelter or interim housing or chooses not to. The first step is just access, right? And so the intention is to make a no wrong door approach where it doesn't matter if somebody shows up at an agency that perhaps doesn't serve that population, that agency would know, oh, this is not the place, but I know how to get you to the other place. And I know what the answer is, and I know how to direct you and support you. And so it's not about saying no, but figuring out how does each partner agency in the context of this network coordinate and effectively serve as a front door into the system. By into the system, usually that means by the conducting of an assessment tool. If I am making a decision about who to house and there's 2 households and 1 resource and I'm using my best judgment, there is no way for me to determine what actually is truly the best, and my best judgment may be different than yours or yours or yours. So the intention of having an assessment tool and having a survey is to be able to start making choices in a more objective fashion rather than just based on advocacy or impulse or subjectivity. So the assessment does create a score. The score is not the be-all, end-all to a human being because human beings are incredibly complex, but it gives us a place to start and helps us do a little bit of apples to apples for the reality of the fact that all human beings are different. From that point, we make some decisions about prioritization. So there are many, many resource types in coordinated entry. There's, of course, permanent supportive housing and rapid rehousing, kind of the golden ticket and the hopes that the thing that many people hope they might get in that they're permanent housing. But there are also a variety of types of interim housing. There are different case management supports, housing navigation supports. We heard reference to shallow subsidy, legal services, rep payee services. The list kind of goes on and on. But in terms of prioritization, For the permanent housing resources that we do have, we want to be strategic about those limited resources. So we want to apply them to those who have most need, who are least able to remedy their housing crisis by themselves. And so how we do that is through a centralized function, which we call matching, which connects most vulnerable persons to housing for which they would be eligible. So this all sounds great. How come you haven't solved homelessness yet? You might ask. Despite the joy of having Measure H and having this influx of dollars and resources and doing that work of propping up all these new programming, the stark reality is there still isn't enough. We in the coordinated entry system had 27,000 persons newly assessed just last year alone. So that is people newly presenting saying, yes, I'm here, here are my issues, I need help. That's a lot of people. For those people, there are not sufficient housing or interim housing beds. There's about 7,000. There's been the recent initiative by the city, a Bridge Home, to add more shelter beds, but so the numbers, slowly increasing, but not nearly what it should be relative to need. Of those, only about 1,400 are for general use. The rest are for perhaps veterans or families or women fleeing domestic violence, et cetera. And we estimate that there is about just under 10,000 permanent housing resources of the permanent supportive housing and rapid rehousing type available in the system within a given year. We know from our numbers last year, we housed even more than that despite what we had. So there's still some creative, ingenious work that's going on out there that doesn't rely only on these, hard and fast system resources. The last thing I will say super, super quick is that might seem a little bit of a sad thing, but there is amazing innovative work that's going on now in the context of partnerships. One is LA HOP, which is the Homeless Outreach Portal. It's an online way to request outreach for someone experiencing homelessness in the community so that outreach teams who are all coordinated on the back end can be dispatched. And I'm sorry, the thing I didn't have time to talk as much about, but perhaps we'll get to in the Q&A, is the current really awesome work going on that we have working with the healthcare system, trying to coordinate. We've shifted in a conversation from how does the healthcare system get access to coordinated entry to saying there's a system gap between our two systems. There aren't enough resources, but people who are experiencing homelessness, who are bouncing between our systems, need to get served. How do we do that together collectively? How do we patch together the resources? How do we target those most in need? And how do we figure out answers for homeless patients and homeless persons, especially those with exacerbated health issues? So it's a little bit of what we are up to.